as well as logically flawed. All right, well, let's take a look at Dr. Dan's top 10 tests. Starting with number 10, we have lipoprotein A, which I mentioned before the break, and cholesterol. Now, cholesterol has become a cottage industry. We're not a big fan of that testing, and I know that many of you are taking cholesterol-lowering medications, and it's an absolute waste of your time. What you need to be looking at is your ratio between good and bad cholesterol. In other words, you need to take your HDL and divide it into your total cholesterol, and that ratio should be 4.5 to 1 or less. If it is, then you're in good shape. Now, I know that they like to break that down to all different types of cholesterol, but you can't be too focused on those numbers. They change actually quite radically depending on what you're doing with exercise and diet, having little or nothing to do with medicine. If medicine lowers it by 10%, they're slapping each other on the back like they've done something wonderful, and you can do better than that with diet and exercise. Why is it important that we have a decent cholesterol? Well, if you don't have cholesterol, guess what? There's something you can't make, and it's one of the most powerful elements in your body, one of the most powerful supplements we have available to us, and that is hormones. You can't make hormones without cholesterol. Imagine that. You know who has low cholesterol? Cancer patients. That's who has low cholesterol, because you also need cholesterol as natural antioxidant. So please be careful, my friend. But the one test that you should get in conjunction with that is lipoprotein A. That indicates if you have inherited risk towards elevated or high blood fats or lipids. And as I mentioned before, there is a treatment for that. That is niacin or B3. That's the only thing known to lower your inherited risk of blood fats. Niacin or vitamin B3 for lowering lipoprotein A. Test number 9, CBC and CMP. Now, I say those together because they're typically ordered that way. So when you go to your conventional medical doctor, there's 3 things he's going to order as part of your annual exam. And many patients tell me they had a thorough laboratory exam. By the way, this never happens, ever. It's impossible to test for everything. What they mean is my doctor tested my CBC and my CMP and my lipids. Big deal. CBC is your complete blood count. Now, there's some things you can obtain from that which are quite interesting, but sometimes you have to look closer to figure out what that is. I mentioned a couple of patients I had in my office this morning, both of whom had an immune deficiency. You get that by looking at the total white blood cell count and multiplying it by the percentage of lymphocytes. That's not something that's going to show up in flashing red lights on the blood test. The doctor simply has to know for it and to look for it. But you can also test if somebody is anemic. You can test if somebody has allergies, if the eosinophils are high. And you can possibly get an idea if they have parasites, depending how high that number is. You could check to see if they have monocytes, which are your macrophages needed to recognize and eliminate viruses, cancers, and so forth. CMP is your complete metabolic profile. This gives us a broad spectrum of your kidneys, your liver, your electrolytes. Very important, and these 2 tests are relatively inexpensive. Test number 8, CRP. This is C-reactive protein. Why is this important? Well, it's a general marker of inflammation. Now, if you have a rheumatologic disease, you can check for your sedimentation rate. You can check for your rheumatoid factor. But CRP can be elevated in other conditions unrelated to rheumatologic or joint diseases, such as diabetes. You may see it elevated because an inflammatory process is going on in these people. You could definitely see it elevated if somebody has an infection. And sometimes you might know why it's elevated, but it is associated with heart disease, and it is measured as part of that profile. That's test number 8. Test number 7, hormones. Now, there are many different types of hormones, but if you're a man, of course, you want to be checking for testosterone. We recently had a patient who was taking testosterone, and we were concerned because his free testosterone was low when his total testosterone was elevated and not normal. But sometimes it just takes some time or the right prescription to make sure it's properly being absorbed. And we do this through a compound pharmacy using a lipophilic base, which allows that natural product to get into the bloodstream. And so when we rechecked it, it's now perfectly normal. But in the women, you want to check things like their FSH, their estradiol. If the FSH is high and estradiol is low, guess what? Sometimes estradiol is 0. They're in menopause. Now, some people believe the elevated FSH is what contributes to breast cancer. the brain constantly trying to stimulate hormone production that's not there. And it's no big deal to supplement with some natural hormones like progesterone, possibly Tri-S, which is a